Hi, I'm Miriam, one of the physiotherapists here at Fit for Life Physiotherapy. Today we're going to go through an exercise called the dead bug that is commonly used in physio rehab programs, but it's also seen common in fitness classes and Pilates classes. And I want to make sure that you're getting the most out of this exercise. So let's break it down a little bit. So make your way onto your back. And first, you want to start with knees bent, and let's focus on the breath and how we use the breath to engage in our trunk and our abdominals. So if we place your hands here just around the side of the ribs, I want you to take a few breaths in and feel the ribs expand out to the side, and when you breathe out, feel how the ribs come down a little bit, okay? Just getting that sense of movement of the ribs here. Then take your fingers, if you take your thumb at the base of your rib cage and your pinky finger down at your hip bone here, okay? Take a breath in, breathing in through your nose. And when you breathe out, as if you're breathing out through a straw. So purse your lips and blow the air out. So that you should feel that the rib cage comes down, and it's almost like these 2 points come a little bit closer together. So you're going to breathe in through the nose and breathe out through the mouth, bringing those 2 points ever so slightly together. And in doing that, you'll feel your abdominals connect and contract. You don't want to feel like you're just pushing your back into the ground. Yes, you're going to feel your abdominals tighten up, but it's not necessarily engaging them in the way that we want that is going to be most effective. So if we think of, here, I'm just going to move this arm out of the way, take a breath in, and exhale, that I can feel a little bit of lengthening through my spine. I can feel the abdominals engage without my back being forced into the ground. So that when we get to the next part of the exercise where we're lifting our knees into tabletop, so take a breath in. As you exhale, lift one leg up. Take a breath in and exhale, lift the other leg up. And as you lift the other leg up, you're going to feel like your back is going to want to arch away. And we're using this connection with our abdominals to stop that from happening. Again, you're not doing this and just forcing your back into the ground to keep your legs up. We want to keep your back in that nice sort of neutral position. So exhale, blow out through the mouth, bringing one leg up, take a breath in, and as you exhale, lift the other leg up. So the first part of the dead bug is just the movement of the legs. So take a breath in. As you exhale, tap one foot down towards the ground. Inhale to come back up. Exhale, tap the other foot down. Inhale to come back up. If you find that when you're tapping your foot down, can you see how my body just kind of moves with me, right? There's not a whole lot of engagement here in my trunk that is keeping my spine in that same position. So I want to really use the exhale, which is when we naturally connect with or contract our abdominal muscles, to help with that work, so that there's an exhale to tap down, inhale to come back up. And you'll see how the shape of my spine doesn't change. I'm not just allowing this to happen, because if that happens, as I said, we're not engaging those muscles, but you also might start to feel a little bit of discomfort in your lower back, particularly if you have some existing back pain. So if you find that that's a bit of a struggle, you can start with just one leg at a time. So exhale to tap down, inhale back up. Exhale, tap down, so that you can get that sense of keeping your spine in that neutral position so that it's not lifting up every time you move that leg. Once you feel comfortable that, yep, I can do that toe tap where I'm keeping my spine in a neutral position, then we can start adding the arms. So bringing the arms up towards the ceiling, that as you tap your left foot down, you're going to bring your right arm back behind you. Inhale back up. And I want you to really blow the air out so that your exhale isn't just a, it's a Well, I just did the same side. So you want to do opposite side. Exhale to drop down. Exhale, moving opposite arm and leg. And if you're finding that each time you're finding your back is arching, then make it a little bit easier. Step back from there. There are lots of ways that we can challenge that dead bug by adding some TheraBand, adding some weight, all of those kinds of doing them on a foam roller. And we will get to those in another video. But for now, give that a try. Really feel that connection of using the breath and the exhale. And the exhale is not just a, okay, I'm just breathing out. Make it a forceful exhale as if you're blowing out through a straw, as if you're trying to blow out candles on a birthday cake, where you can really engage with those abdominals. And that exhale isn't necessarily fast, it's just a controlled, and feel the difference. And if you're having trouble with that, then talk to one of your physiotherapists and we can work through that with you. We'll see you another time.